Our second presenter is Eli Schulman. He'll be presenting his thesis on the impact of 2019 Kincade wildfire in Sonoma County, California, on emergency room visitations. His thesis advisor is Tim Devine from the School of Public Health, and his thesis reader is Andrew Chang from Stanford University and also Public Health at Stanford. Yeah. All right.
Thank you. Yeah, so as I said, my name is Eli Schulman, and this is my presentation on the effects of the 2019 Kincade wildfire on ER hospitalizations. So a little background on the issue. Wildfires have been a perennial issue in California. Since 1932, when records first began, there has not been a year on record without a wildfire in California. Now, this is largely due to the climate in California. California has the unfortunate mix of being very hot, very dry, and have a lot of burnable vegetation, which leads to these pretty regular yearly wildfires. Additionally, due to the effects of anthropogenic climate change, these wildfires are actually getting worse. And because climate change is causing lower precipitation, increasing these droughts, and is also increasing the temperatures, which create the perfect conditions for a wildfire to grow and spread. Also, wildfire seasons, the time when a wildfire is able to grow and spread, are lasting longer. In the past, they had just been in the summer months when the temperatures are hottest, but now they're extending into the autumn and even winter months. If you look at this chart of the worst wildfires in history, the 5th worst was in September, and the 8th worst was in December, which you would consider much later than the usual wildfire season. And lastly, wildfires are growing in extent. The 2 worst wildfire seasons in the history of California occurred in 2020 and 2021. In 2020, over 4 million acres burned, and in 2021, over 2 million acres burned, which is a very substantial portion of California. There are some pretty serious health effects from these wildfires. The burning of vegetation and man-made materials releases hazardous pollutants, and as wildfires encroach on more human settlements, they're burning more and more man-made materials, which create much more hazardous pollutants. The main pollutants are particulate matter, carbon monoxide, nitrogen dioxide, as well as ground level ozone and a host of other pollutants. The main danger with these pollutants is that when you breathe them in, they can cause a host of issues in both respiratory and as well with other systems. Particulate matter is especially dangerous. The World Health Organization says that it is the cause of over 4 million deaths a year. So as I was saying, the 2 main health effects are cardiovascular and respiratory. With cardiovascular, when you breathe in this wildfire smoke, you have increases in heart failure, heart attacks, and heart disease. And for respiratory, when you breathe in this wildfire smoke, you have increase in emergency room visitation for asthma, COPD, and other issues related to lung inflammation. There's also been some studies that show that there are some pregnancy related issues. There's low birth weight or premature births for mothers who were exposed to wildfire smoke in the 2nd or 3rd trimester. There are also psychiatric effects of wildfires. Children who have been exposed to a wildfire or lived near a wildfire have shown symptoms of emotional distress, such as PTSD, increased anxiety, and increased depression. So we're going to now talk about the Kincade wildfire of 2019. It was the largest wildfire of the 2019 season. It was in primarily Sonoma County, which is this county right here in the middle, as you can tell. It burned over 77,000 acres of land, burned for just 14 days, but in that time, it caused the evacuation of over 186,000 people. And what's very unique about this fire is that the prevailing wind pattern caused the majority of the smoke plume to be blown out over sea, which means that we're able to look at the effects it had on Sonoma County while comparing it to a different county in California that did not have as much of a smoke exposure. This brings us to the project idea. The idea behind this project was to identify the public health effects of this Kincade fire on Sonoma County. Through doing this project, we realized a control county would be very interesting to look at, and that's why it was decided that Shasta County would be our control county. Shasta County is very similar to Sonoma County in both demographics. The median age is very similar. The percent of people over 65 is very similar socioeconomic status, as well as it's a very large size. Sonoma County is over 400,000 people, and Shasta County is about 200,000 people. And Shasta County had a third of the smoke exposure that Sonoma County had. So for this project, we had 2 data sources. Our emergency room utilization data came from this place, the Office of Healthcare Access and Information. This data set was comprised of ICD-10 codes, which are epidemiological billing codes that let you know why someone visited the ER and what the disease group was that they were there for. We also used the National Oceanic and Atmospheric Administration Hazard Mapping System, which is a map of smoke plume densities and size given by geostationary satellites. For this, we had two main goals of the study. The first goal was to compare fire timeframes in Sonoma County to the less affected Shasta County. To do this, we used logistic regression models, and these compared the exposure, which was the fire time, either the before fire time, the during fire time, or the after fire time, to the outcome, which was any ER visits for our selected disease groups. As you'll notice, we compared everything to the before fire time because that was when there was no smoke exposure. And this allowed us to have like a wide range of just kind of see if there was any effects that occurred. And the second aim was to identify the health effects of this smoke plume exposure to try and get the dose response relationship between increased smoke exposure and ER visits. To do this, we used a generalized estimating equation with a Poisson link. And this used the exposure of wildfire plume density as given by the NOAA data set. And the outcome, again, was any visits to the ER for our selected groups. And the reason why this model was selected was because it operates at a zip code level, not a personal level, and it allowed us to see if increasing the smoke plume density had an effect on increasing hospitalizations. These are the ICD-10 codes we were using. As you can see, there are four main disease groups we were looking at: cardiovascular, cerebrovascular, respiratory, obstetric, and psychiatric. These aren't really important. I just wanted to show what disease groups we had. And then also we had some specific diseases of interest that we were also looking at. And this is RStudio. It is a programming language that I used for all of my analysis. It allowed us to create these models, import these data sets, and really figure out everything in one place. It was very helpful. So now this is just the initial numbers of hospitalizations. As you can see, they have the fire times before, during, and after, as well as the disease and the number. I want to direct your attention to the respiratory, where we can actually see a pretty significant increase in the number. And if you look at the proportion, because there's only 4 days afterwards, the proportions are increasing throughout the entire fire time. Additionally, asthma sees an increase, which is a respiratory issue, as well as COPD, which is another respiratory issue. When you compare that to Shasta County, which was less affected, you see that respiratory there is a little increase, but it's not nearly as substantial as the one in Sonoma County. Additionally, asthma and COPD do not see many increases. So now this is our actual logistic regression model. This shows the change in ER visits over the different fire times. And it produces an odds ratio, which is a measure of the strength of association between the fire time and the likelihood that you would be in the ER with this specific disease. If you look at Sonoma County right here, these are the numbers I'm going to be talking about. That shows a 19% increase in the odds that you will go to the hospital during the fire and a 75% increase in the odds after the fire. When you compare that to Shasta County, we actually see a decrease in the odds that you will be at the fire. That is a 52% decrease and a 65% decrease after the fire, which is pretty substantial when you think about how much more Sonoma County was exposed as compared to Shasta County. And this was our smoke exposure results. This showed the change in ER visits due to the different smoke plume exposures. This produced a relative risk, which compares the risk of a health out event among groups. As you can see, these stars indicate statistical significance, and we have a statistically significant result with the high density smoke plume resulting in a 31% increase in the relative risk that someone will be visiting the ER for a respiratory issue. Now, interestingly, we actually see a decrease in both the cardiovascular for low, medium, and high density smoke plumes. Going back over the data after we had finished analysis, we realized that our ICD-10 codes for cardiovascular diseases were actually really broad. They ranged from heart attacks to just all-case chest pain. And it turns out that people were not really going to the hospital with just a little bit of chest pain when there was a wildfire that was raging right outside their window. But they were still going to the hospital with heart attacks. Those remained pretty stagnant. I'd also like to point out that if you look at the high smoke plume intensity, you're seeing kind of some of the increases in the relative risk of hospitalizations. So what does this data show us? One, it shows us that Sonoma County saw an increase in respiratory issues across not just both the fire times, but also across the increasing smoke plume density. And when you compare this to Shasta County, which was less affected by the smoke plume, there's actually a pretty significant trend that the respiratory diseases are caused by the smoke plume exposure. Additionally, we see that the greater the smoke plume exposure leads to a higher relative risk of ER visits. So there were some limitations to this study. While Shasta County was identified as the best control county available, it may still have been a little bit imprecise. It turns out that they have really poor long-term air quality. The American Lung Association gave them an F grade for ground level ozone, which is a lung irritant. That could have messed up our numbers a little bit and could have introduced some bias. Also, the evacuation introduced a systematic error in the data. For example, we don't know where the 186,000 people went. We don't know their ER utilization in their new locations, and that there could be a lot of people with cardiovascular or respiratory issues that we're not even seeing in the data. And lastly, as I said before, our cardiovascular ICD-10 codes are likely not an accurate representation of our health effects. We could have used a more granular approach here and tried to really narrow down what was happening. So some conclusions from this. One, smoke exposures does have a negative public health effect, and more intense exposures lead to worse outcomes. Also, we're seeing a very short-term effect. We weren't sure before this study if we would even see an effect of these fires like immediately during or after the fire, but the fact that we're able to see something so quickly is very stark and pretty impressive. Also, this shows the effect of just one wildfire in one county. In 2019, there were over 6,000 wildfires. If each one has this effect, it's really showing the danger that people of California are in. And as climate change continues to worsen these conditions and continues to worsen wildfires in California, people are continuing to be at risk. So really, the overall conclusion is that wildfires are bad. So this work was actually requested by the Sonoma County District Attorney in a case against PG&E, which is Pacific Gas and Electric, the company responsible for starting the Kincade fire. The work from this project was used to show that the fire negatively impacted the people of Sonoma County. And as a result, PG&E settled and agreed to pay $55 million for both the Kincade fire and the Dixie fire, which was the largest fire of 2021. So that is a win. So some next steps, I would like to determine how to identify ER utilization of the evacuees. I think it'd be very interesting and could really add to this analysis. I would like to maybe use a different method to model the time series data, such as an econometric difference in difference model, which can really show you a side-by-side effect and can actually give you statistical differences between Sonoma County and Shasta County. And lastly, I would like to expand this work to look at the relationship between smoke plume exposures and health effects across the state. We have the NOAA data. We know that smoke plumes are pretty prevalent in California. I'd like to see how this affects everyone across the state. So now I have to thank my two mentors, Dr. Tim Devanch, who did not need to be my mentor, but he agreed, and he was just as enthusiastic as I was about this project. And this last year has helped me so much, and I could not have done this without you. And Dr. Andrew Chang, who might be on Zoom somewhere, he taught me how to use our studio, and all of the pretty models today were mostly him. I could not have done this without him. Thank you, guys.
Research being used by California to come up with ways to control these wildfires or reduce these wildfires so that they have the support that it's bad for people's health. So what are we doing to help eliminate that?
Unfortunately, no. My research was used to show that it is really bad, and so that now we're like making PG&E pay, and they're going to try and buff up their power lines, which is the down power lines is the reason why the fire started. But besides that, there's really not that much culpability. They just have to pay a big fine.
As far as the psychiatric, like, would that be something that might come like for months later? Is there any thought of like checking like longitudinally, like what the impacts might be? And also like given the pregnancy issues, like how does that impact long term by wildfire exposure?
Yeah, definitely. We did that analysis because the data was there, and we thought why not. But those are two that you definitely see an issue and probably an increase later. There'd definitely be a lag with those. And it'd be interesting to see how long it takes before that lag to spike. But that's kind of guesswork. We would just need a ton of data and then look and see eventually if there was a spike or not. But yes, you would most likely see an increase later on.
I was just wondering your personal connection to Sonoma or Shasta County.
What?
Your personal connection to the counties.
I do not have a personal connection to Sonoma County, but I do live in Northern California. And so I've been through wildfire seasons. I've driven through one of the wildfires. I was on the list for one of the biggest in California history. So that really inspired me to do this work.
Did you look at any non-California data like the Australian wildfires and see anything similar?
We were only able to get health data for California because of the case. So I would be interested to look at other places, but I would need their health data, which is not necessarily readily available. Right.
About going beyond, I think, what you actually studied, but obviously these wildfires continued during the pandemic. And I'm just wondering if you had any thoughts or any other research that tried to explore the kind of compounding problem of dealing with respiratory virus and wildfire.
Yeah, this was actually one of my original ideas, and then I was talked out of it because it's very hard to identify which respiratory hospitalizations are because of COVID and which are because of wildfire. And since this is de-identified data, you can't really distinguish between the two. So you'd be like, wow, there's a lot of people in here with respiratory issues. But you don't know if it's because of the pandemic or because the wildfire is right on their door. But it would be very interesting to see.
We'll stop there. If you have more questions for you.